And welcome to my presentation on oral health in age 65-year and older adult patients. My name is Carolina Peranto. I am currently an LPN in the LPN to BSN program. In this presentation, we will go over Medicare age patients 65 and older and poor oral health, why this is bad in that population, as well as what can be done about it. Our learning objectives for this presentation are: first, at the conclusion of this presentation, the viewer will be able to classify a population at risk and how an individual 65 years or older fits into this category. Secondly, at the conclusion of this presentation, the viewer will be able to classify symptoms of change which can be implemented in this community. The community being a Medicare patient 65 years or older. Third, at the conclusion of this presentation, the viewer will be able to identify how healthcare providers and the community members, who are the 65 and older age group, can communicate to make changes in oral health. At the conclusion of this presentation, the viewer will be able to recommend changes in oral health care for populations over 65 years of age. At this time, if you could please take the pretest, if you could pause the presentation, complete that, and then resume the presentation. There's also a brochure to take a look at while going over the information in this presentation. Our population at risk is Medicare age patients 65 years or older. According to healthypeople.gov, 1 in 4 Medicare age adults do not have any of their teeth. This is significant because it shows that 25% of people age 65 years or older do not have any of their teeth. This is bad because it leads to poor nutrition, being unable to eat due to having no teeth to chew, only being able to eat certain softer foods. That leads to not being able to eat raw vegetables or raw fruits, which are highly nutrient dense. This also causes increased bacteria in the mouth and inflammation in the gums. This causes poor social function and self-esteem. In this age group, it's important to keep social contacts and relationships in the community. They are more prone to depression and chronic health issues, and it's important to keep a solid support system. 1 in 7 adults aged 35 to 44 has gum disease. It jumps significantly as a Medicare-aged patient. 1 in 4 adults after age 65 has gum disease. 46.3% of older adults have seen a dentist in the past 12 months, which seems like a decent number, but that shows that almost 54% of older adults have not seen a dentist. That's more than half of older adults 65 years or older have not seen a dentist in the past 12 months. That shows that they're not getting preventative care or care for existing issues. Also, more than 7,800 people die of oral and throat cancer every year. A significant amount of those people are older adults. This is preventable or treatable at early stages, and you can only find cancer in early stages when you're getting health care and somebody is able to see it before it progresses and metastasizes. Why is this bad? Links between poor oral care and cardiovascular disease and diabetes. Patients with poor oral care have a higher risk for issues such as stroke and endocarditis, an increase of 19% for cardiovascular disease in patients with periodontal disease. This increases to 44% in patients 65 and older. A patient who has diabetes mellitus 2 and periodontal disease is 3 times at a greater risk of mortality. Having poor oral care also increases bacteria in the mouth, which can travel to the body. This causes issues like stated above, endocarditis, and other bacterial issues. Total tooth loss increases the risk for poor or malnutrition, leading to other chronic diseases. Poor nutrition leads to issues such as diabetes or hypercholesteremia, which causes issues to patients, leading to chronic diseases such as hypertension, or can cause stroke if the patient is not getting any care, and continues with the poor health. This also leads to social implications of multiple or total tooth loss. Patients do not have good self-esteem. They do not want to be in the community. They do not participate in the community, and this causes issues for them socially. It causes anxiety and depression, which can get worse over time. What can be done about this? Working with long-term care homes and other communities that house Medicare-aged patients to create systems of change. What are those systems of change? Promoting good oral care, making sure that patients are getting oral care and that is added to the task list and nursing care plans for every patient who is 65 years or older. Following with a dental professional, making sure that the patient gets preventative care and any acute care that they need for any existing issues. Making sure that the patient gets good oral care means that they are brushing twice a day and flossing, making sure that there is no issues after their meals. Another issue with Medicare-age patients is sometimes they are not able to get their oral health care supplies. Providing oral health care supplies in the community and long-term care homes, whether the patient is unable to leave the home or if they are unable to take care of themselves, as in patients with dementia, that they are provided oral health care supplies. Also working with healthcare providers to perform routine oral care in patients with dementia or Parkinson's disease, which are patients that have a harder time with self-care activities. What else can be done? Patients again can follow with dental professionals, working with healthcare providers to refer to dentists during annual Medicare checkups as well as annual health screenings. Doctors should follow up with the patients and refer them to dentists as often as possible, reminding them how oral care is health care. Promoting oral care as health care and lobbying to have preventative oral care with every health plan. Oral care should be added in as a preventative in health plans. It should not be a separate health plan. It should not be an extra cost. Promoting communication with healthcare providers, dental providers, and other care providers such as nurses in home care, nurses in long-term care, any home health aides in the community to educate and promote good oral care in these patients. At this time, if you could pause the video and take the post-test. Also, take a look at the brochure that is provided as well if you have not already done so. And then start the video again. On the next slide will be the answers. If you would like any more information regarding this, healthypeople.gov has lots of information regarding oral health and how to get better oral health care, as well as what populations are at risk for poor health care and what we can do about it. And here are the post-test answers. Thank you very much for listening to this presentation. I hope you have a wonderful day.